is the sixth most common cancer in the UK. Around 11,000 people are diagnosed with lymphoma each year.
I'm Phil Macker, immune system.
Well, lymphoma is, in most, like other types of cancer, it's usually a cancer in older people. And the incidence is increasing actually by about 3 or 4% every year in this country, largely because the population is getting older. But perhaps one thing that's different compared to other cancers is that it does have a tendency to affect younger people as well. It can affect children, adolescents, young adults.
About 80 children of all ages develop non-Hodgkin's lymphoma in the UK each year.
We'll see a significant number of younger people in the 20s and 30s in Blackpool every year who've developed lymphoma.
Well, one of the difficulties with having lymphoma, from my own personal view and from talking to other people, is that when you are initially diagnosed, there's very, very little knowledge that the general public have got of what lymphoma is.
What do you know about lymphoma?
I don't know anything about lymphoma.
Not a lot.
What do you know about lymphoma? You've never heard of it? Okay. Do you know anything about lymphoma?
I've never heard of it. Anything at all.
And I'm pretty well up in the world, but I've never heard of it.
Throughout your body, everywhere in your body, you have tiny little glands which you normally can't see, which their role is to protect you against infection. So if you get a virus or a chest infection, the glands in your neck or your chest will usually swell up and then go down when you get better. With lymphoma, the glands keep on growing and get bigger and bigger, and maybe glands in other places can start to swell up. So usually patients with lymphoma, the first thing they notice would be a swollen gland in the neck or the armpit or in the groin, which doesn't really get better. You can develop lymphoma in any part of the body, so if it develops in the chest, the patient obviously can't feel a gland in the chest, and by the time they're getting symptoms like breathlessness or chest pain, the gland can be quite big. There are actually many different types of lymphoma. Here we'll see maybe about 30 or 40 different types of lymphoma in patients. But there are two main types of lymphoma. One is what we call high-grade lymphoma, and this is a type of lymphoma which behaves like cancer as most people understand it, where they become very ill, they lose weight, they need chemotherapy, and they can often be cured without treatment for high-grade lymphoma. But there are other types of lymphoma which we call low-grade lymphomas. And with low-grade lymphomas, they often don't need to be treated.
I was on no medication at all after my initial chemotherapy. And for maybe about 5 years, maybe 5.5 years, I was just going for regular checkups about every 3 months, and then they went to 4 months. And then I noticed a little lump in my neck just on this side here. So I knew that something was wrong. So they had a look at it and did another biopsy scan, and they told me that it was the follicular lymphoma had come back, but we'll just keep an eye on it. And I went on what was called a watch and wait, which some people call whittle and worry.
The disease doesn't go away completely, because with low-grade lymphomas it's very difficult to get rid of it completely. But it goes down, they get well again, and then maybe a few years later they start to get more symptoms and they need more treatment. So low-grade lymphomas have this pattern of a more chronic disease that can go on for many years. It's a pattern of remissions with treatment and then later relapses. So patients can have the disease for sometimes 10, 15 years and maybe have 3 or 4 different courses of treatment over that time.
The lump had actually grown very, very much, very, 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 very large. So they did obviously another biopsy. I knew that treatment was going to be necessary. Dr. Machita, once all the results had come back and they were rushed through very, very quickly, he said, well, because it's gone into this, you're going to need chemotherapy, radiotherapy, and then stem cell recovery.
Stem cells are very early blood cells found in the bone marrow, which all blood cells develop from. In stem cell transplants, the cells are collected from the body, frozen and stored. High-dose chemotherapy is given to kill all the cancer cells. The stem cells are then replaced and they find their way back inside the bone marrow and start to make blood cells again. The incidence of non-Hodgkin lymphomas in general appears to have increased in recent years, and the reason for this is not entirely clear.
Many patients ask me what's caused lymphoma, and we'd have to say that despite all the research that's been done, we don't really know at the moment. What we're sure of is that things like smoking and drinking alcohol are not really associated with developing lymphoma. It's very unlikely to be anything that the patient has done to cause lymphoma, but at the moment we can't really say what causes it. It's probably some combination of genes or a tendency that some people may have to develop lymphoma, and something else in the environment that they're exposed to, perhaps a virus that we don't know about yet, or some toxin in the environment that we don't know about. But we really don't know what causes it.
Although it's unproven that fruits and vegetables prevent lymphoma, we went to find out what people think about the impact of healthy eating.
I run a health food shop in Fleetwood called Wild Oats. My name's Jo, and I get a lot of people that are getting more health aware and conscious of what they're putting into their bodies. Fresh fruit and veg, natural foods rather than pre-packed processed foods, and supplements to help with their health in general, really.
We buy all sorts of fruits, and I even put them in the blender and make the shakes out of them, everything, like, you know, just for the wife's sake and my sake, health-wise.
Well, I eat quite a lot in the course of a week. Apples, pears, bananas.
Vitamins and minerals your body can't manufacture themselves, so you need them in your food or in a supplement as well to support your diet, just so they're essential for your body's life. The herbal side of it, there's different constituents in the different types of herbs that are good for particular types of things, so there's something for everything.
After first being treated for lymphoma in 1997, Philip launched a support group for people in the area suffering with lymphatic cancer.
I knew that the Lymphoma Association, because we got the magazines, ran support groups, so I made inquiries about the possibility of a lymphoma support group being set up in Blackpool.
I think it's always helpful for people to know that there are other people out there who've got lymphoma and who are having chemotherapy, who are feeling exactly how they're feeling.
It's to make a very, very safe environment for people who have got lymphoma, and this includes the relatives, families and friends, to come along in a very informal atmosphere and chat about issues and concerns, because many people are living alone. I'm very lucky because I've got Danusia. She's very supportive. She really, was behind me all the way during the treatment.
There are many people out there who've been cured of lymphoma, so it's useful to go and meet people who've been through the treatment, who've dealt with the side effects, who've completed the treatment and who are now cured. And that is a source of encouragement for the great majority of patients. It shows them that there is light at the end of the tunnel.
The people at Victoria Hospital in the haematology department, you couldn't wish for a better group of people. It's almost like a family. I mean, I've been going now for 10 years. And everyone's on first name terms. They know you by face, and it really is excellent support that they give from there, and that's what we hope to try to do in the support group as well. Having the lymphoma has given me a completely different outlook on life. I mean, I know I've got something that is not going to go away. It's going to be with me for the rest of my life. I don't dwell on it, but it's always with me.
I think the first thing to say is that the treatment of lymphoma is really one of the success stories of cancer medicine in the past 20, 30 years. Treatments, there are two main types of treatment. One is chemotherapy. Usually it's a relatively gentle chemotherapy where patients don't need to come into hospital. They can have most of it as a day case. And in combination with chemotherapy, we often give patients radiotherapy as well.
But I think, might be the wrong word, but I think in some ways, looking back, it's been a privilege, because I could have had a heart attack 10 years ago, and that could have been it. it's given me an opportunity to look at life, as I say, and try to become a better person.
To find out more about your local support group or for more information on lymphoma, contact the Lymphoma Association on 08 08 808 5555 or visit lymphoma.org.uk.